Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the consult. My name is Brittany DeSherry. I'm the COO over at Rejuvime Medical. And today I have with me, of course, Dr. Jonathan Weiler.
Yes, board-certified plastic surgeon in practice, I don't know, 15, 16, 17 years. I'm getting old, I forget. Founder of Weiler Plastic Surgery Group, largest aesthetic plastic surgery group in the state of Louisiana, and Rejuvime Medical. And to my right,
Taylor Besh,
wonderful Taylor
Weiler Plastic Surgery. We are so excited to dive a little bit deeper in a very prevalent issue.
Big problem.
Big problem in our society, hyperhidrosis. So what the heck is hyperhidrosis?
What is hyperhidrosis?
So everyone looks to me. So hyperhidrosis is excessive sweating, right? And so it can be the armpits, where I have sweaty pits. It can be the hands, and it can be the feet, or it can be just in general on your scalp.
I was about to say scalp, forehead, the bottom of the feet.
Yes.
You said hands.
Yeah. So hyperhidrosis is a problem that affects a large percentage of the population, in my opinion. Like Taylor said, it can happen all throughout the body.
Yeah.
You can just be a heavy sweater. Some people are heavy sweaters. Some people have heavy head sweat when they're in parties or get nervous, right? Some people get really sweaty palms. Some people have really sweaty feet. And then what we're really going to focus in on is the sweaty underarms because we will talk about a device that can cure that.
That's right.
Nice.
I would say it becomes a debilitating problem for some of our patients that you cannot take lightly. Honestly, some of my female patients who present on stage, they are traumatized by having, armpit sweat that they
because you have
cannot
to wear clothes,
prevent it. Yes.
And once you, even if you're sweating before you go on stage, it's evident, right? So it is.
I have one patient that can't wear heels because
she
foot
slides.
Slides.
Really?
People who don't want to shake hands because it is, dripping sweat whenever you shake people's hands, and they feel that they come off negatively because, but so it is a huge issue.
It is.
We are going to dive in deeper, like he said, on the axilla today, the armpits, because we have a device that can fix this.
Right. And also the armpits is, to me, in my mind, the sweating in the head and the arm and the hands and the feet is more of a visual or touch thing. The armpits can sometimes get a little stinky.
Yes.
So not only can you sweat excessively, but you can smell excessively too.
Yeah. And you can't control it. I mean, it can be a, trigger
it's
of,
not your fault. It's just, it's happening.
Yeah.
So this device is called
MiraDry.
MiraDry. So Dr. Weiler, I'm going to pose the question. What is MiraDry? Give us a little history.
Well, I think we ought to talk a little bit first about hyperhidrosis.
Okay.
Sure. Yeah.
We'll get into the MiraDry thing, but to me, hyperhidrosis it's really just an overproduction by your sweat glands. And you've got two types of sweat glands, apocrine and exocrine. Right. Get a little detail there. I did a little homework. I also know I'm a doctor. So
I'm a doctor.
But some people, it's not that they have more sweat glands than others, it's they're stimulated a little bit more by the nervous system, right? And so it can be just generalized fear, anxiety. It presents itself instead of a fluttering heart, you get sweaty. Instead of a stomach issue, you get sweaty. And so it's mostly an overproduction of sweat by these two types of sweat glands. And so it can present itself as head sweat, right? And Taylor, you do Botox for that. So Botox can help very well with head sweat, right? You can't use MiraDry on head sweat. We'll talk about MiraDry.
Yeah, so back up before MiraDry. I mean, treating every area that we discussed, they have a topical solution called Dry Sol that does a decent job, very temporary. So
I don't know. So
have you used it?
Yes.
Like over time?
Okay.
I have used Dry Sol. So I would say I'm a person that falls into the hyperhidrosis category. Growing up, it may have been more of like a younger puberty thing, maybe more of a nerve thing. But the first line would be like a Drysol, and Drysol is basically it's a topical medication that you apply. It's primarily indicated for hands, feet, and underarms.
Yeah, because we would have patients wrap themselves with saran wrap.
You apply it,
yeah,
and you wrap saran wrap around it at night. It does burn a little bit, and basically it's ablating or burning the sweat glands.
Yeah.
It can be effective in patients that don't have severe hyperhidrosis. And so it worked. It helped for me. It is painful. It is a process, multiple applications over multiple weeks or even months to get an effective result.
You hesitated when I said temporary. So how long would you say Drysol helps?
I think it got me personally over the hump.
Okay.
I think that, I would categorize myself as a heavy sweater, bigger, bulkier guy. Probably back in the day had a lot of social anxiety. And so I think combination of that would cause some issue. It necessarily, I would get some pit staining, I guess you call it, right?
Yeah.
But it wasn't crazy. And it's not certainly anything I had later in life.
Yeah.
With the Drysol, is there is there a treatment period? Like you do it for 6 months and then off, or is this just like every
you
forever?
do. So I'll be honest, I can't remember exactly, but you do multiple applications on a nightly basis over a period of a few weeks. Then you do take a break, and then you
I would pulse dose patients.
Okay.
Yeah,
so they would consistently use it and then took some time off and then
take some time off because it does, and it works in some patients. I think it can be effective, but it also is a commitment. It's a little bit painful. And
I can't imagine sleeping with
saran wrap
on your
luckily, I don't have any problem sleeping, but if you don't have problems sleeping, you ain't going to sleep. So it certainly can work, but it can only be applied. You can't wrap your head in saran wrap, and you can't apply it to your head.
Right.
So it doesn't work there. So the second line,
that leads into Botox.
Is Botox.
Yes,
and Botox is absolutely wonderful for hyperhidrosis, and I do a lot of it. I would say the only negative aspect of it would be budget because Botox has, it's going to go away. So it can last 3, maybe 6 months in all of these areas. It is not exactly cost effective all the time. It absolutely works, but you're going to be seeing me every 3 to 6 months.
I would assume it's a lot of units that you're having to use.
Yeah. So for instance, axilla underarms is usually 50 to 100 units, usually 100 units every 6 months.
Okay.
I've injected hands plenty, the bottoms of the feet plenty, the head and the scalp, and it absolutely works. But MiraDry, and we'll get to that, is indicated for the underarms. So Botox is still very popular for hands and feet.
Correct.
And head and scalp, but I think that it's kind of transitioning over time to, we used to be primarily Drysol, Botox to the underarms, and I think it's absolutely transitioned more so to MiraDry in that area. Yeah,
I would say probably your primary treatment in the scalp is going to be your Botox.
Correct.
Because it also has some cosmetic benefits.
Well, and I was going to ask, how does Botox help with the sweating?
So it actually stops that sweat gland from producing the sweat. So if it kind of goes to this, if you treat Botox in the forehead, not even talking about sweat, it's going to help with acne and oil production. So it's going to stop all of those processes from producing as heavily as it normally would.
Yeah, not only you see it like when a patient has just skin glows better with Botox. Yeah. It's weird. It actually improves. Not only does it eliminate wrinkles and fine lines, but it actually, in my opinion, improves the appearance of your skin.
Yeah. Yep.
Gives you this sort of glow, right?
Yeah.
Glotox.
Yeah.
But it also, by the way, it's going to eliminate any heavy sweating. So Botox is, you want to talk about a miracle drug.
Yeah.
It's a whole lot of stuff Botox does.
I'm all in. We talked about this, the Big Mac, the things we're here for it.
Yep. No, absolutely. But really beyond cosmetic, it does a whole lot of stuff. And it's a very, very effective, popular injectable medication these days.
And another big thing you said with hyperhidrosis, for the axilla, sweating is debilitating, but the smell is the very embarrassing part as well. And I don't know if there's a treatment that really helps specifically that. I think MiraDry is the kind of one-stop shop to address all.
Yeah. So
all things.
So we'll kind of take it a step back and talk about the science, right, of what's going on. So you have these sweat glands all over your body. The ones, and they're mostly exocrine. I think I'm getting that correct. Sweat glands. The ones that are associated with your hair follicles are apocrine, right? And so they actually leak a little bit of the sweat into the hair follicle area. And then you have a bacteria that lives in that hair follicle mostly, right? And then that bacteria starts to break down the components of the sweat. And that process of breaking down the components then leads to an odor, right? I think I'm right. We all have bacteria that lives everywhere in our body. Even though people like to scrub it every night, I do. I take a shower every night. We still got the bacteria growing on us. And that's primarily what causes the odor. Now, everybody produces, I almost dropped my cup there. Everybody produces different sort of amounts of odor or types depending on diet, depending on, hormones, pheromones, all that goes into that sort of chemistry. But we all have odor. Even the most delicate, dainty woman has underarm odor. And that's really occurs with puberty, which is when we develop those secondary sexual characteristics, which is basically where we develop hair on our hair-bearing areas, right? Babies smell so good because they don't have any of those glands working. They don't have they have head hair, but they don't have any body hair because they haven't had that surge in hormones. When we develop our secondary sexual characteristics, that's when those apocrine glands click in with that hair-bearing area, and that's when that nasty sort of breakdown.
My 12-year-old, y'all.
I always tell a story.
He stinks.
So I always tell a story. So I have a teenage boy. And putting deodorant on a teenage boy or getting him to put deodorant on is a battle, right? So he was in a thing called cotillion, which is these dances, right? And so we took him to this cotillion. It was a 7th and 8th grade dance, and the place was packed. And it was in this big dance room. They had a DJ going. It must have been 120 degrees in there. Right?
Oh, no.
And so there's multiple stories that came out of this dance, but the story related to the odor was, so we picked the boys up, and there's like 6 boys and a couple of girls, and it was my daughter, my son, in the car, and they're all a little sweaty. And my boy turns to me and says, it stunk in there. Oh my goodness. I've never smelled anything like that.
All these pubescent children.
My God.
I'm like, that's why I make you wear deodorant. Because half the kids in there forgot or lied to their parents and then put the deodorant on. It did smell in there. So that puberty age just really stinks it up.
Especially
right?
at cotillion of all things.
Yeah,
It's
right.
like, get it together, guys. Come on.
Not like a bunch of sweaty 12-year-old, 11-year-old boys, right? I don't know. It really stunk. So so it really gets into that. That puberty is when we start to develop that smell. But Botox, very effective in different areas, right?
Right.
But really what we're here to talk about is the underarm area, which is probably in my mind, sort of one of the most difficult areas, because you've got the smell.
It's visible.
It's visible.
It's visible.
Clothes.
I think, like you can hide your hands.
Yes.
You can, hide your feet.
You can have a towel.
You can't hide.
Right.
Yeah.
Especially like you said. And so MiraDry is a device, and we'll bring Trisha in just a second, who's our expert in MiraDry, and talk about it. But MiraDry is a device. It's actually been around for a long time. Surprisingly so, right? You had this statistic?
So FDA approved in 2011.
Right.
It is now in 50 countries being used and utilized. So it's been around for a long time. The device has been perfected through the years, but it is very safe, very effective device that Trisha is going to kind of, fill us in more about it. But we do a lot of MiraDry at Weiler Plastic Surgery, and it can be life-changing for people. I mean, truly.
And so really so the device is fairly old, but it really wasn't really well known until, like you said, 2011, right? So it really wasn't well known like 2016, 17 when it really kind of took off. But it was the most popular device in Hollywood for a very long time.
I can see that.
You can see that, right? Because if you're making a living, mostly in clothes in Hollywood, right? And you can't really have those pits going.
Yep.
Right?
Well, no, I mean, think like actors in front of the lights, in front of the, all of that.
Heat associated with that,
heat.
Yep.
Well, good. So let's take a quick break. We want to thank our sponsors, right?
Yes.
We want to thank Weiler Plastic Surgery Group, the largest aesthetic plastic surgery group in the state of Louisiana, all the way from Botox to tummy tucks. We do it all, right? And then Rejuvime Medical, the age-defying clinic, your go-to resource for hormone optimization for both men and women, and also for GLP-1s and for injectables. So stay tuned, and we'll be right back, guys.
My name is Casey. I live in Hammond, Louisiana. As I was approaching my 30s, I started to notice a few wrinkles here and there. I just wasn't happy, so I decided to make a step to change it. I've always known of Dr. Weiler's practice, and that was always my first choice. The first time I've ever been here, I was a little nervous, but once I got there, everyone was very welcoming, made me feel at place, and it's made me look visibly younger. I have more of a confidence boost. I feel better about myself and in my own skin.
My name is Amber. I'm from Gum Springs, Louisiana, and I'm currently on semaglutide. I started my weight loss journey a few years prior and just kind of struggled with getting to like that final weight loss goal. I decided to get on semaglutide because I was really working towards like those last 20 pounds. Working with Rejuvime is so simple. When you really have that person that's like in your corner, like they're cheering you on, they want to see you hit those goals. I feel like I'm healthier, I'm at that wonderful weight. I just feel really confident, feel comfortable in my skin.
Welcome back, everyone. We are going to get an expert opinion here from our guest, Trish.
Hi.
Tell us a little bit about yourself, what you do and everything, and kind of how you're involved in this MiraDry process.
So I am a body contouring specialist. So I do basically everything from the neck down with the body. So
Okay.
that's how I got involved with MiraDry.
Okay. How long you been doing MiraDry for, you feel like?
I've been,
How long have you been a body contouring
Yeah, how long have you been a body
specialist?
contouring?
I know,
So
I'm like,
I've
what a
been
fun
at
job
Weiler
title.
Plastic Surgery doing body contouring devices for 3 years now, and MiraDry over a little over a year now.
Okay. And so tell us what, you in your mind, MiraDry is. Does that make sense? And talk to us about your patients when they come in and ask for it a little bit.
Okay, so how I describe it to patients is MiraDry is the only FDA cleared device that uses thermal energy to permanently reduce sweat and odor glands, and you also get an added benefit of hair reduction as well.
Oh,
Wow.
okay.
Yeah. So who
Okay,
doesn't want
so,
that?
like, all right, there's just like a lot of there's just like a lot in there. Like, okay.
So it is a device that uses thermal energy to reduce odor, sweat, and hair.
So is it like a
Yes.
laser?
So yes, technically it is like a laser. So it's a device that I put on the armpit area, and what it's going to do is administer that thermal energy. I'm getting my devices mixed up now. That thermal energy down to the sweat and odor glands. It's basically going to heat them up and kill them off.
And kill them off.
Which is what we all want.
Yeah.
You can expect an 82% reduction of sweat and odor gland.
With a single treatment or double treatments.
So the science behind it is they guarantee the 82% after 2 treatments. So I always recommend two treatments to every single patient. If you're coming in the door and you're concerned about it, you might as well just do the 2.
Right.
Get the maximum benefits
Because
from
people
it.
that are coming in have a hyperhidrosis, right?
Yes.
The majority of people that come in have a serious issue with, staining, overproduction of sweat or odor, right?
Correct.
Now, you do have a few people that come in that just want the sort of cosmetic benefits of it, where I don't have to wear deodorant anymore, or I don't have to shave my armpits, or I don't want to have any sweat anywhere in my body. And so I do feel like some of those patients may get away.
Okay, I will say with one, because many years ago,
Yes.
we pretty much advertised it as 1, and then if you were still having a problem, 2.
Right.
So I think what he's saying, I agree with. If it is a true hyperhidrosis patient,
You're
for sure,
double. You
2.
need 2 treatments. And I
Is
agree
this
with you.
2 and done?
So, yes, you may have the patient that just has a little bit of sweating, a little bit of odor, could possibly get away with 1 treatment.
Right.
However, when you do something, you always want a little bit more. You always want
Yes.
the best results.
True.
So that's why I encourage people to do 2. However, we do have the patients who do have the hyperhidrosis who are sweaty betties.
Yep.
Okay. You can come in after 12 weeks after your second session. If you're still having issues, what we're going to do is a starch iodine test to see where the sweat is still coming up at. And at that time, we can talk about doing a 3rd treatment. Is it typically necessary? No, it's not.
Okay.
Does it happen from time to time? Yes, it does. So if you need that 3rd treatment, we can do it. But honestly, in the year or so, I haven't had to administer a third
A
treatment.
third.
But people have to understand you're never going to be 100% cleared
Correct.
of
Yeah.
the sweat and the odor. It's an 82%
Right.
Do you
guarantee.
have to come back like in X amount of years to like re-up?
I mean, I don't think so, but you never know. Why do we sweat? Why do we have odor? I mean, our lifestyle can obviously trigger that. Hormones, aging, everybody is different under there.
Right.
So
Yeah.
start with the
this.
two
It's like
treatments.
Like a 2 and
Yeah.
2 and done. Yeah.
I
think
mean, they do stand by permanent
correct.
reduction. So is there going to be reduction? Absolutely.
100% no. Okay. That's fine.
100%
Well,
no.
it's a-
Reduction, yes.
Okay, so it's a little it's a little bit different. So like we do a lot of laser hair removal, right? And so laser hair
That's
removal,
right. That's what I was going to
yeah,
say.
goes into your hair gland. Your hair follicles are in different stages, right? And so it does take multiple treatments, and your body can regrow a little bit of hair. But you really have minimal hair after laser hair removal. This is a little bit different. Your body does not typically regrow sweat glands.
Yeah.
Right. Especially this type of sweat gland that produces the odor. So it does, that thermal energy is destroying that sweat gland forever. Doesn't destroy them all. And that's where we get to that sort of 82%. It'd be literally impossible to almost get there. But I do find, and I don't know, but I do find a lot of patients no longer even wear, a lot of patients don't even wear deodorant after this because the reduction is so significant. So,
And some patients do see the benefit a week after the treatment.
wow.
I'll have patients say like, oh, I haven't even put on deodorant since you did my first treatment. Do I need to come back in for my second treatment? And of course, I'm always going to encourage you because as the weeks go by,
Right.
you could start to see
Yeah,
a little
right.
bit more start to
Right.
pop up. So let's just knock it out.
Right.
And when do
Hey.
you do the second treatment? How far out?
12 weeks out.
12 weeks.
Okay.
Okay.
Let's do this. So take us, all right.
Yes.
Take
Go
us through
back
the
to the
process.
beginning.
Yeah. And so if I come in and I'm like, I'm really sweaty.
Okay.
Please help me. And like, how does it go?
Okay, so let's pretend you're coming in for a treatment. You're going to come in, you're going to get comfortable, lay on the bed. We'll put on a Netflix movie for you, and I'll have a nurse come in. They'll administer
Netflix and
lidocaine. They'll administer lidocaine injections. We want to get you nice and numb for the
Okay.
treatment.
Now, this is for
Is
your
it
first
painful?
treatment.
Yeah.
Your very first
How do you
treatment.
know if you're, is there anybody who's not a candidate for this?
Oh, yeah.
So, of course, we do have patients who suffer with what we like to call HS, and Dr. Weiler will let you pronounce it. Okay? 'Cause
Hydronitis.
I don't want to
Yes.
butcher it.
Yep, hydronitis.
Right.
Which is a very debilitating disease where you get chronic sort of infections and tunneling of these glands. And it can be an awful disease. And so that is one of the main contraindications, primarily because the infection is almost always there and you have tunneling beneath the skin that you're not aware of. And it's really not best to be treated with this type of thermal energy. And
Okay, so he used to treat a lot of
Yes.
hydronitis, and it is truly a debilitating disease. I have always wanted them to research more and like the medical part behind them. If they were not in an infected state, they were controlled. They had been on Bactrim, and they were
Yes.
good. MiraDry could be life-changing for them if they actually were treated in the right.
okay, so I do believe that, and I do.
I mean, not that we would offer that, but
Well, look, I would say that if you adequately pre-treat and you eliminate any sort of active infection,
Right.
and it's a very, very minor case of hydronitis, it's probably not a bad
Yeah.
option. I totally agree with that. The problem is, though, that hydronitis can be a debilitating. I mean, you can get it in any sort of
hair-bearing.
hair-bearing area, which is underarms. It can be in the pubic
The
area.
groin.
It can be in the rear ends. I always tell a story. This is a horrible story. We had a guy when I was in training who had his entire backside, and he was actually homeless because of it. And we brought him in. I know this sounds crazy. We actually had to divert his intestines outside. We went in, skinned off the entire backside, brought him back a few days later, grafted him. We had him in the hospital for 3 weeks, and walked out the door. And eventually he was a carpenter and went back to work and had a house.
Amazing.
Yeah, it is.
yeah.
So it is a very debilitating. So I do agree with you, Taylor, that in certain situations,
Yeah.
after extensive review with the doctor and all this. But as a policy, we say,
Okay, yeah. Back on track. Sorry.
MiraDry is not the best choice for that.
Right.
But in theory, yes. All
You
right.
should be a spokesperson for this.
So
I know,
hidradenitis is a
terrible
no,
disease.
right? It was right off the bat.
Yes.
Anything else? Any other thing where you
I
say,
mean, if you have a history of staph or MRSA, that's okay, as long as you're not having
Active.
an
An active
active
flare.
issue at the time. If you do have a history of it, we'll put you on some antibiotics a few days before treatment. You come in, you'll be fine. Now, back to your original question of who is a candidate for MiraDry. So basically anyone who sweats, anyone who's smelly. If you put on deodorant multiple times a day, if you're wearing clinical deodorant, if you have sweat stains, which I'm wearing black
basically,
right now.
if you breathe and
don't
you're
see mine.
alive,
Yeah.
if you breathe and you're alive and you want to get rid of
Yeah.
whether you don't have to be an excessive sweater for this procedure, right? You can be someone that says,
Just a little bit. If
Wow.
you're self-conscious, just wearing like a colored top,
Yep.
a light colored top, and you have
Yep.
sweat stains
I
come
mean,
through it.
this is everyone in South Louisiana where we are.
Yeah,
Gotcha.
correct.
Like where
and this is why it was the most popular device in Hollywood.
Yeah.
Yeah,
Right?
I'm
If you
like,
get
it's
paid-
hot.
Yeah.
I mean, if you don't sweat, you don't have odor. You're a unicorn,
Yes.
basically.
Yeah.
So
Yeah.
come get MiraDry.
There we go. All right. So you said that you put lidocaine.
Yeah, we'll start the treatment with lidocaine injections just to make sure you're completely numb, so you're comfortable during treatment. You don't feel that thermal energy going into the actual armpit
You have to
area.
inject my armpit with lidocaine.
Yes, but it's little tiny meso needles. They're teeny
It is
tiny.
not as bad as you think.
So like we
because
talk
it's-
about where the
I
wuss
know.
is, and
It is microscopic. The first one has a little sting, but these needles are so tiny. And once you have that little
okay. So you're
initial
saying
sting,
needles,
You'll be fine. That's why you're going to watch TV.
multiple needles.
Yes,
Watch
but
a movie.
because it's like a little.
They're
does
tiny
like
little
this.
needles, and they go in. It's like a little grid, right? You put a little grid on the armpit, and then you go in. You just numb up the skin.
Yeah,
It's
we
not
just
bad,
want to make sure
Brittany,
you're totally
truly.
numb and comfortable.
I remember the first time I saw it, I was like, "What's that?" And I was like, "What's that?" And they were like, "Oh, it's MiraDry." And I was like, "Well, that kind of
You want to be
cool.
numb before you do the
have to be
MiraDry. Yeah.
Unless you like the sensation of a curling iron hitting the armpit
Yeah, right,
area.
right. Okay, so numb you up with lidocaine. You're fine. You can put ice right before, get it nice and cold to negate the sting. Our nurses are amazing. Okay, lidocaine.
Lidocaine, easy and over with, under 5 minutes, you'll be fine. Then I start the procedure on you. You feel absolutely nothing the whole time. So it's fine. So what we're doing during that process is we're administering the thermal heat. It's going down to the hair, the odor glands, the sweat glands, and we're just zapping those away, making dreams come true.
There.
How long does that part take?
I would say from start to finish, from the time you enter, from the time you leave, 2 hours. The actual treatment, about an hour, but you coming in, getting comfortable, getting your injections, doing the treatment, leaving, 2 hours is what we're going to ask.
Is
you
there
to be
anything
for.
you have to look for after? So like after I've completed the treatment, is there
It's-
anything?
Yeah, so it's very important for patients to ice every 20 minutes on, 20 minutes off. Why do you want to ice? Is because we want to control the swelling. You don't want to wake up with big, softballs under your armpit the next day.
How
I
long
want
do
you
you
to
have to do that for the 20 on, 20 off?
I would say do it for the rest of the day after treatment. If you could do it the next day, great. Nobody wants to be swollen, but put on a t-shirt, you're covered, you're fine.
Yeah.
The most important thing with MiraDry is I'm going to ask all patients for the next 7 days after treatment, we want to be very cautious, just conscious of the area. You want to keep it very clean. I don't want you to use any fragrances under the armpit. I don't want you to shave. I don't want you to put on deodorant. Take some alcohol wipes, put it with you in your purse, in your pocket. If you go to work, you start sweating, just give it a quick little wipe down.
So that's what I was about to say. It's like working out after. You just kind
I
of
don't want you to work out. I don't want you to do anything that's going to induce
yes,
sweat.
that's
Increase the sweat.
Just
Sweating.
Reduce
you
that
want to
sweating.
give those little microchannels full 7 days to completely heal.
Okay.
You just don't want to risk any bacterial infections.
Yeah.
Don't submerge yourself in water, bathtub, or anything. Just be cautious and clean in
Yeah.
the area, and then you'll
Yeah,
have
yeah.
beautiful, smooth results.
But
and
I
we'll it
do
again.
feel like, the only side effect in my experience is swelling.
Okay.
And it's a little uncomfortable because it's underneath your arm, but you go about your day, your work the next day,
Yeah.
just with limited activity. But
Yeah.
you can still do everything.
I mean, I've
right
had
after.
patients go straight back to work.
Yeah. Okay.
After the treatment's done. You just have to hold that ice pack under your armpit. And you could do one arm at a time. It's fine. 20 here on, 20 off,
Yeah.
and just rotate. It's easy.
Yeah.
And you see results as soon as, what did you say earlier?
So I've had some patients tell me that 7 days later, they're still not having to put on their deodorant, that they're fine. But, I will be honest with you, some patients do go through an actual purging process for about 2 weeks after treatment. Everyone is different. We're all going to get different results.
So by purging, you mean just like excessive? Or
yes, like they'll see an uptick in the sweating
Okay.
in the purging process.
As those glands are dying off, they're like, I wanted my last
Yeah,
hurrah.
Yes.
I'm going to get them this time.
Going out with a bang.
Going out with a bang.
That's why you hide some alcohol wipes in your pocket and just do a little wipe down as often as you need.
And so, take us through, so did they come back before their second treatment, or they just schedule their second treatment? How does that work?
You'll schedule your second treatment before you leave.
Okay.
We'll forget if we don't. And then 12 weeks, you hang out, you're cool, call me if you need anything. And then 12 weeks later, you come back and we repeat the process over again. And then 12 weeks after that, we're going to do a little follow-up. I would like patients to come in, do the starch iodine test if they're still concerned about sweating.
Right.
So we can see where it's still producing. And then at that time, we can talk about if we need to possibly do a touch-up third session.
Describe what a starch iodine test is.
I was about to say, what's the starch iodine test?
So it's exactly in the name. I'm going to put some iodine on the armpit.
Betadine.
Yep. And then we're going to just sprinkle a little bit of the starch on there. And then you hang out. And once sweat starts coming to the surface, it'll turn black like little coffee beads. And you'll be able to see where you're still producing the sweat at.
Okay. So if I am still producing at 12 weeks, I mean, it's fine because, right?
It's fine.
It's fine.
Remember, you go, so
Yeah, 'cause with
it's
that
not
82
complete resolution.
Yeah.
It's
Looking
not
at
gonna
it
be
at
100%.
right?
Yeah.
So you're going to have a little bit of sweat.
You just want to make sure that it's not a lot of bit of sweat.
Correct.
Yeah.
Correct. It's going to get
And
you.
there's no contraindication to doing a third treatment. Correct?
No,
You can do
there's
it
not.
at that
I mean, it's
12
rare that people need the third treatment. Like I said, I haven't done a third treatment on anybody yet.
Okay.
But we can provide the starch iodine test. So if it is a concern and you do want to keep pushing and try and get the max results, it's an option.
Yeah.
Is it necessary? No.
Yeah. What is the price point for something like this?
So it's always better to buy in a bundle. So you can do 2 MiraDry treatments for $3,000. If you want to do a single treatment, it's going to be $2,150, and then if you decide later on that you do want to do the touch up, it's $1,200. So you save a couple $100 by just going ahead and buying.
$3,000 is not a lot
To
for a
not have to
life-changing.
sweat, that's it.
Yeah.
Yeah, and just think
That's
about
what
how
I'm
much
saying, like,
money
this
you
is
spend
too
on
much.
You're not going to ruin any
deodorant.
more T-shirts.
No.
Especially for a man,
That's
right?
what I'm like.
Spend a whole lot of money on deodorant. I have to wear a little bit less cologne.
Could it replace laser hair removal of the armpits?
I
Or-
wouldn't say it's going to replace
Okay.
laser hair removal.
Yeah, how much of a reduction do you see typically in hair? Would you,
I think with hair about 70% reduction maybe, but I would always still recommend, I mean, laser hair removal is the best thing I
Yes.
think I've done besides Botox
Yeah.
over at Weiler. I wouldn't use MiraDry only as your only form of hair reduction.
Okay.
Go
So you
ahead
can
and just
combine
get that
both.
laser hair removal. Yeah.
Okay. Can you do that on the same day? I don't know that answer.
We could do that.
Okay.
Would you have to do laser hair removal for the MiraDry?
Yes,
Yeah.
I
okay.
would. Your poor armpit.
Yeah. I'm like,
Laser hair removal is really easy though.
Yeah.
It's quick and painless.
Yeah.
so
know, but-
how do you think your patients feel afterwards? Like any miraculous
Yeah,
stories?
talk about
that-
emotion.
Yeah. What's the emotions that people feel going through this? Because this can be a very debilitating thing.
Well,
for
it's
many
always
people.
funny to watch the process of everything we do, from the consultation to the treatment and then to the follow up and the results, because people come in and they're nervous and they're self conscious, and then it becomes, wow, why didn't I do this sooner? You know, and that's the best part of this industry is that you're really helping build people's confidence.
Yeah.
So that's the best part there. I do have a lot of people within that 12-week span between the 2 sessions. They're like, oh my God, I haven't worn deodorant. I don't have to keep deodorant in my purse anymore. This is so great. So, I mean, it's nothing but a confidence booster. So why not do it?
Yeah.
And I think this cuts across both genders equally.
Oh, absolutely.
Men and
I
women.
think.
Yeah.
Yeah.
An armpit is an armpit, you know?
Right.
Yeah, I'm like everybody's sweating.
Yeah.
It doesn't matter. It is
Yeah.
not. It is not gender specific.
Right.
No.
Like
Yeah.
by any means. So
I'm still holding on to the fact that MiraDry, if you're listening, is going to come out with
Hello,
a
MiraDry.
hand device
Yep. They've talked about it for years.
and feet
Right.
device, but they've been talking about it. Is not out yet. I have patients ask me honestly very often about it. So that's still in the streamline, but I think it's going to happen.
Yeah, I'm not an
got to.
engineer. I'm sure there's some obstacles
Yeah.
to overcome.
Yeah.
The armpit is a more forgiving area than the hands, obviously, and the feet. But
yeah, I'm thinking like swollen hands and feet.
yeah, but like you said, you have a patient that female patient can't wear high heels.
Yeah.
I know,
because she
that's-
slips down too much sweat. And I know a lot of guys that don't like to shake hands because of the sweaty,
yeah.
the sweaty hands.
Yep.
which is
I'm
crazy.
like, call me though, because I have sweaty hands.
Yeah.
So when y'all get it,
I mean, that's part of the process.
Right.
That's typically what people ask about once they're confident with
Yep.
MiraDry under the armpit. It's like, well, what else can we do? What about my hands, my feet? What about my glutes? What about the top of my head?
Right.
And it's just like, whoa,
Right.
calm down.
Yeah.
We'll get there
coming.
eventually.
It's coming.
Just
Eventually.
Botox for
we'll
now.
Get there.
It's coming.
We'll get there.
Well, Tricia,
Yeah,
anything
funny.
else to add or
I know.
anything that
If
you
you're
want the
thinking
audience
about
to
it,
know?
just do it.
Yeah.
Just come on in.
it's one of those things I agree. You're like, people are like, why didn't I do this
Yes.
years ago? Right.
Correct.
Yeah. Before we end, what is the youngest person that you've treated?
The youngest was about 15 or 16.
Yeah.
Came in with mom and we
Yes.
just knocked it out.
Yeah.
I mean, if you have a parent there, can sign your consents for you.
Yeah, I mean,
I
a
mean-
young girl,
Yeah.
a teenage girl,
Yes.
with debilitating hyperhidrosis,
Yes.
is
It's got to be awful. Just, I mean,
I know.
high school's mean.
Yeah.
And so it's like, if there is something that can help.
And I feel like kids are starting or going through the puberty process younger and younger and younger. So get them in. I mean, if you've gone through puberty and you're having issues, and like you said, school is just debilitating with bullying and whatnot. So just come in, get it done.
Yeah.
Complimentary consultation.
Complimentary consultation.
Complimentary
We can even do the
consultation.
consultation over the phone. You don't necessarily have to come in for a MiraDry consultation. You can if you want. That's great. But if you're busy, if you're a little embarrassed, intimidated, over the phone
Yeah,
is
I
fine.
think that's one of the
Yeah.
biggest. You just said the key word. I think one of the biggest issues that keeps people out of these types of procedures is embarrassment and fear. Right, fear of the unknown. Right, fear of that. Like they're gonna walk in, you're gonna laugh at them and be like, "Yo," and
Oh, she's going to smell me. I
exactly,
stink, you know?
exactly.
Yeah.
And then fear of like these bizarre things you read online, and so I think it's always important that you're a warm, welcoming person. It's a safe environment.
No judgment zone.
No judgment zone. We all are human. We all have some smells
Yeah.
we don't like. We all sweat, right? And so, and I guarantee you, whatever you think is the worst, she's seen worse, right?
Yeah.
Correct. Yeah.
That's what I tell everybody. I
Right.
was like, guys, in the nursing field, once you get into
Yeah.
this medical field, there's always something.
body
more
is a
that
body is
a body.
We all have the same
body
things.
is a body. It does not. It doesn't matter at all.
Right. And pricing is very transparent. The procedure is very safe, very, very easy to go through, and it's highly effective,
Yeah.
which is
Yep.
amazing.
I know, that's awesome. That's so awesome.
Thank you.
I know, Trish.
Thanks,
thank
guys.
you
Thanks for
so
having
much.
me.
Trisha, thank you so much.
It wasn't as
for
bad as you
joining
thought.
us
I know you were
today.
nervous coming on, right?
Are you?
I gotta go have a patient.
She's not sweating under the armpits.
No, I need MiraDry. I do. We're just too busy now. We're too busy to get the
That's
treatments
one of the problems.
done.
The last, it's like
that's it.
if you're married to a masseuse, the last person to get the massage is you.
That's
Yep.
correct.
So,
That's correct.
it's the same
Look, I mean, you got to make the time.
I'll be in the car with the AC on high going back down the road.
No, thank you so much for just telling us about MiraDry and everything. It sounds absolutely amazing. The two and done thing
Yes.
seems so fantastic. But I want to thank everyone for joining us today. Don't forget to follow along on our Instagram
Yes.
as well as our TikTok as well. It's
Yeah.
at The Consult Podcast. And make sure you subscribe to all of our channels. And
Subscribe on
now-
YouTube, right?
Oh, YouTube. And now we're like on Spotify
Yep.
and Apple Play and all the things.
We're basically famous.
We're
Hello.
pretty much famous now. So, but no, thanks for joining us. Remember, always ask questions, stay curious, stay inspired, and we'll see y'all next time.
Thank you guys.